My name is Amela Vladovic. I am a student of Faculty of Pharmacy in Sarajevo. This section is about sales strategy and managed markets. Merck is focused on working with governments and with other country stakeholders to develop strategies tailored to each country's HIV access needs. As part of this effort, they have implemented a differential pricing policy based on, among other things, combination of treatment guideline positioning, patient access, market conditions, country income, and disease burden. Merck began providing Crixivan in March 1996, 6 months ahead of schedule and before new manufacturing facilities were completed. To maximize the use of the initial limited supply of Crixivan, Merck established a managed distribution program administered primarily by Stadlander's Pharmacy. Through this program, Merck has been able to provide the medication to more than 85,000 patients in the US. To ensure a steady supply, Merck would funnel most prescriptions through a single major distributor named Stadlander's Pharmacy in Pittsburgh. That way, the number of patients on the drug could be controlled, which was essential due to supply problems. By contrast, Abbott planned to distribute Norvir to pharmacies nationwide. Uh, Soon, however, Merck encountered a torrent of protests over Crixvan's restricted distribution. Um, its activists accused the company of giving Stadlanders a monopoly that led to it price gouge patients, and retail pharmacists decried getting cut of the deal. However, patients pay much less than the price because of discounts under various insurance, government, and other plans. Distribution expanded to pharmacies in the US that dispense HIV medications. All pharmacies may register to provide Crixivan, and Merck has completed work on new manufacturing facilities, and construction has begun to expand these facilities. Counting and tracking the number of patients taking Crixivan is still necessary due to increased use of the medication worldwide, and because continuous therapy is medically critical for people taking protease inhibitors. Okay, at the beginning, the agency created advertisement for the drug, which featured people scaling a mountain. The message was that there's a fight ahead and Crixivan will help you endure the obstacles. These advertisements were part of the direct-to-consumer advertising, which was consistent with current American Medical Association guidelines. What they did in this campaign is they said that Crixivan turned out to be a powerful and durable drug. That's why instead of scaling the side of the mountain as in first year's ad, they're reaching the top. The first year, their objective was to communicate a change in attitude as far as HIV diagnosis. But as time passes, there has been a change in attitude and there has been more research, and they can start making promises of a longer and healthier life because Crixivan is durable. When we talk about the unique sales tactics, counting and tracking the number of patients taking Crixivan is necessary due to increased use of the medication worldwide, and because continuous therapy is medically critical for people taking protease inhibitors. On the other hand, it provides a continuous purchase of the medication, so we can say that this provides two-way benefit to both consumer and the company. Of course, Merck has a lot of responsibility in providing the necessary amount of the drug and making it available. Merck has also developed a support program to ease the healthcare reimbursement process for Crixvan users. A patient assistance program, PAP, was established for people living with HIV who do not have private or public health insurance and are unable to afford Crixvan. In today's world, internet has an important role in advertising and sales strategies. What has Merck done? They created online website with Merck product information. It is integrated part of their marketing campaigns that provides additional information online. Um, those information can be accessed directly or through links at corporate site or third-party sites or from banners throughout the web. What they did was develop an educational, less advertising-oriented approach to healthcare professionals. Even though Crixivan was one of the first protease inhibitors developed and it quickly became the mainstay of the early triple combination drug cocktail that changed the face of the HIV epidemic, it is almost never used anymore. It caused very severe side effects from dry skin to broken nails to kidney stones, renal failure, diabetes, and abnormal body fat distribution. So today, when used, it's almost always boosted with Norvir.